Alright, this is chapter 43, and we start on page 1078. And I do want to point out to you from the very beginning that we are cutting out part of this chapter, and that's anything to do with children. So this chapter will stop on page, let me get to it. It will stop on page 1097. So 1098 is where it starts skeletal disorders in children to the end of the chapter. We'll not do any voiceover for that. There will not be any test questions on that. So all of this is just, we're focusing mainly on adult. So the first thing in our chapter is musculoskeletal injuries. So the first one here is contusions and bruises. You guys have probably heard a lot about these in the past. A contusion is a bruise, and so this is direct trauma to the body, and we have all pretty much experienced what a bruise is like. A hematoma is a pooling of blood. These can actually cause a lot of pain because it pushes pressure on those nerve endings with hematomas, and you maybe have had those before. A strain and a sprain, we do need to understand the differences between the two. So a strain is an injured muscle or maybe a partial tear in that muscle tendon unit, whereas a sprain is the joint ligament. So it's ligaments, the capsule surrounding the joint. So remember, tendons connect the muscles and ligaments are bone. So a sprain is really looking at the ligaments with the joint. A dislocation, you guys probably know what that is. A subluxation is a partial dislocation, so not completely dislocated. The next topic in this chapter is shoulder and rotator cuff injuries. One of the more common injuries that we see are clavicle fractures, and that's just right there on the front upper portion of the chest. And they typically don't do much for these unless it's a pretty traumatic fracture. Usually they'll put maybe their arm in a sling for a few weeks, or put them in a figure 8 brace just to keep their shoulders in correct alignment. The other things that we do see more often, tendinitis and torn tendons of the shoulder. Those can be pretty painful. Rotator cuff disorders usually have pain, especially at night, tenderness, and then occasionally, just from disuse, their muscles will atrophy. We see a lot of hip and knee injuries with our patients in the hospital and in the ED. So we need to know that with knee injuries, ligament injuries can be very problematic for our patients because they're losing kind of that balance, that good foundation. Meniscus injuries, we'll notice those more when our patients go up and down stairs or up and down a slanted slope. They'll notice that more, their knee will give way. Hip injuries are very common with our elderly patients. Hip dislocation is very painful until we get that back in and is an emergency. They have a ton of pain. They can't move that lower leg. And usually the issue is blood supply getting to the distal part of that leg when their hip is dislocated. So that's what makes it such an emergency. So we need to hurry up and get that reduced. And usually we limit their activities for a while after that, just to make sure we don't dislocate quickly again. The other thing that we see a ton are hip fractures, and we see this a lot in our patients with osteoporosis or just patients that fall. So typically it's there in that joint capsule, and it will just break right there at the head of the hip joint, at the head of the femur, and it can cause a lot of issues for our patients with pain. What we'll see, though, when they come into the ED is their leg will be shorter. The one that's broken will be a little bit shorter, and it will be externally rotated. So that's kind of those cardinal signs of a hip fracture. And what we need to do is get that repaired, and usually that's a surgical repair to fix that. So true or false, the least serious knee injuries are injuries to ligaments. And I'll let you think about that for a little bit. If you want to pause the video and look this up, you can, but I'm going to go ahead and move forward to the answer. The answer here is false. Ligament injuries are among the most serious because they're losing that stabilization of the knee. So if our knee is not very stable, we're really open to a lot more injuries. So fractures, I know that many of us have experienced some sort of fracture in our lifetime. Lots and lots of examples on this slide as far as fractures. The first thing that we want to look at with a fracture is whether it's open or closed. An open fracture is one that has broken through the skin, and you may also hear this called a compound fracture. So this is where we see bone sticking out of the skin. A closed fracture is we have no break in skin. It's still the skin is still intact. A green stick fracture, I know that's not right here on the slide for us, is seen more often in children, and that's a partial break in the bone, usually because their bones are a little softer, more resilient, so they don't tend to break all the way. So that's a green stick. A comminuted fracture, usually that's a fracture where we have multiple pieces. Two bones, usually this is a crush injury, and so lots of trauma usually involved with the soft tissue there. Transverse is just a nice clean break. Usually the ends go together very nicely, and we have very few incidences of issues with healing. Oblique, you can see we have jagged edges there, and we can have actually some injury to tissues around that area due to those jagged splintering bone pieces. A spiral fracture, you can see that it really just is what its name is, kind of goes down and around the bone, and we see this most often in child abuse, something where maybe they've pulled on the child or twisted on the child. Not that every spiral fracture is abuse, but that's what we think of when we see a spiral fracture in a child. Segmental is one that we didn't talk about yet, and it's where we just have a segment of the bone that's broken out of the middle. So it's similar to comminuted, except comminuted has lots of little pieces, where segmental is just one piece. A butterfly fracture is just a portion of the bone, and it's not broken all the way through. And then you can see here impacted, where one piece is pushed into another. Obviously, manifestations of fractures is a lot of pain, and if our patient has been through something traumatic, they may have other issues such as shock, and we'll get to some of the others, but it's definitely diagnosed by X-ray. But what we want to focus on is bone healing, and this is listed for you step by step on page 1086. It starts with number 1, we have the hematoma formation, and then we have some of the fibrin network filling in there. You can see that fibrin meshwork that starts to build. The next step would be our fibrinolysis cartilage calcis formation. So that's that soft tissue callus. So we're starting to build kind of a very weak bone structure at this point. So it's very much like cartilage. This cartilage then becomes much more hard, much more dense, and that's where we have this bony callus formation, which is step number 3, where the calcium salts deposit into the new tissue and start to build that bone. And then we have remodeling, which is the final stage. The bony callus and the dead portions of the bone are gradually removed by osteoclast. So then we just have a normal shaped bone again, where we get rid of all of that excess material. So after this, we should be good to go, get that cast off, resume activities, that type of thing. So which of the following represents the correct sequence of bone healing? So you may want to go back to page 1086 to look this up. This also might be a good time to pause the video. Hopefully you know the answer without having to look it up, but let's go ahead and look and see what the answer is. Our answer here is A, hematoma, cartilage, and then bone. So remember, we have that hematoma that forms, that starts with that fibrin meshwork. Then it turns into cartilage, which is basically just really soft bone, and then turns into bone with those deposits. So we do have several complications that we need to be watching for with fractures. The first one is just skin injuries, and we can see some blisters from fractures. The next thing listed here are muscle injuries and swelling. So when we have a fracture, a lot of times they'll put on a hard cast, and they've really been starting to get away from the hard cast because of the swelling. So what happens with compartment syndrome is we have a really decreased size or decreased area for all of the internal structures to swell to. So what happens is we have collapse of our arteries and vessels just because of the pressure that's being put on them from the swelling. So we can actually lose pulses distally and really compromise their limb integrity, where they may have to have it removed if we can't relieve the pressure. So we may have to cut the cast off, or even do an eschar or a escharotomy, open that up so that we can relieve the pressure and allow blood flow to reach to the distal end of that arm. Another issue that our patients can develop is a fat emboli. And if you remember from our video from Hank, the yellow marrow is in the middle of the long bone, and when that breaks open, that fat can actually get out into circulation. So the main two issues that we can see from that, obviously, is a pulmonary emboli or a stroke. So those are some things that we need to be watching for. And then, of course, we can have pain that lasts for a really long time, complex regional pain syndrome. So this is more injury to the nerves, and that can just cause a lot of long-term issues for our patient. Another issue that we can deal with our patients being admitted to the hospital is osteonecrosis, or osteomyelitis, Osteomyelitis is an acute or chronic infection of the bone or even the bone marrow, and it's broken down into different types. But what I want us to realize is we really have to treat whatever the problem is. So if it's a bacteria, this may be through direct contamination, we need to get them some antibiotics. And then we can break it down into the different types of osteomyelitis. This hematogenous happens in children in the long bones. So we may have some exudate inside the bone, and then obviously this is going to damage arteries to the bone because we know how very vascular our bones are. This can actually penetrate skin and involve joints. In adults, we see this more often in our vertebrae, sternoclavicular area and sacroiliac joints, and usually this affects more of the joint space and less of the skin issues. Chronic osteomyelitis, we can have issues where we have dead bone separating from living bone. We can have a sheath of new bone around dead bone, which is going to just cause problems for our patients. I haven't seen this very often, so I wouldn't spend a whole ton of time studying about chronic osteomyelitis. What we're more concerned about is acute. Osteonecrosis is kind of the last of these infection agents. So the ischemia is caused to the bone maybe from a fracture or an emboli, compartment syndrome, and then also steroid therapy is listed here. And what happens here is it's avascular necrosis, meaning we don't have good blood flow to the bone and it starts to die. So what type of bone disorder is associated with thrombus formation or embolus? And you can read through these. I'm going to go to the answer here. You can look it up. You can pause the video if you need to. And the answer here is osteonecrosis C. Bone, remember, is very rich, has a very rich blood supply. And when we lose blood flow to an area, it's going to cause necrosis, and that happens sometimes because of a blood clot. So the last section here in our book looks at neoplasms of the bone. So these ones listed on this slide for you are benign bone tumors, which are not typically a huge problem because they're not metastatic. This is not cancer, except in the case of giant cell tumors. Now this is not a malignant bone tumor, but it behaves very much like a malignant tumor. So with the giant cell tumor, or the osteoclastoma, it's an aggressive tumor. It can metastasize through the bloodstream, but usually that's after a local excision where we did not get it all. So it is not malignant, but it does act kind of like a malignant tumor. Our malignant bone tumors are, the first one listed here is osteosarcoma, and you guys have probably heard of osteosarcoma before. It's very aggressive, highly malignant, happens a lot often in younger individuals, and also individuals with other predisposing risk factors. Men are more commonly affected than women. Cause of this is unknown, but this is where we have to go in and actually remove that portion of bone, and sometimes this means an amputation for our patient, and usually we do chemotherapy along with this before and after surgery. Chondrosarcoma, this is a malignant tumor of the cartilage, because remember chondro is cartilage. Ewing sarcoma, these are tumors that are characterized, they're very densely packed, regularly shaped, very small cells with a certain type of nuclei. Primarily a disease in children and young adults, rarely seen in older adults. Most frequent site is the femur. So they will have bone pain, limited movement, tenderness of over that involved bone and soft tissue, and usually they'll also have some fever and weight loss, which actually leads to some more confusion as far as what the diagnosis may be. The other one is metastatic bone disease, and these are sometimes other cancers that metastasize to bones, so most common malignancies are found in the bone. There are many other cancers that when they metastasize, they spread to bone. So most often when we have metastatic lesions, they'll be in the spine, femur, pelvis, ribs, and then also proximal humerus, sometimes the skull. Less common in sites more distant from the trunk of the body, more common right in the trunk area. Okay, so true or false, osteosarcoma is a common bone tumor in adults. And you can pause the video if you want to look it up. But the answer is false. This happens more often in adolescents. 75% of these patients are actually younger than 20. Okay, so that is the end of the lecture for chapter 43. Please go forward now and do the activity listed for you on the website and on Moodle, and we will discuss those answers in class.